You know, the practice of medicine is inherently stressful. You're trying to take care of people, you're trying to take care of people quickly, you're trying to not make mistakes, you're trying to make people feel seen and heard and valued, all of which takes time. And then on the flip side, you have the pressures from COVID-19 itself. I can say, and I'm still fairly young in my career, but I've never experienced a situation where I'm also concerned about my personal health and the health of my family and my loved ones. The first time I received a positive COVID-19 test for a patient I had swabbed myself, I remember looking at that test result on the computer screen and feeling as if I was crawling in COVID. I felt like I could not get clean enough because it was like this invisible enemy. And since then, I have lost count at the number of positive COVID tests I've been in contact with, but I continue to worry. You know, will I be this young person that succumbs? Will I be a statistic? And so, you know, that we can't take those personal fears lightly. And then you have the uncertainty of this virus. You know, people want answers. Parents ask me questions about coronavirus that I don't have answers to, that nobody has answers to. And that's very uncomfortable as a physician, to not have answers. We were trained to always have answers. So even saying, I don't know, I'm not sure, I'm sorry, you know, we're learning with you, it doesn't feel good. In my spirit as a doctor, it doesn't feel great. And, you know, so all of this is against the backdrop of all of the other things, all of the other stressors that go with just being who I am, being in this Black female body, practicing medicine. So, for example, I've experienced racism in medicine myself. I've witnessed racism in medicine directed at my patients. I have experienced sexism and sexual harassment. I have an ongoing battle with imposter syndrome and self-doubt. You know, I often worry and wonder, am I good enough? Am I smart enough? Am I enough? I struggle with moral distress. You know, I worry that I'm not able to do the things for my patients that they really need because of the limitations of the healthcare system in this country. The limited visits, this focus on revenue and this sliver of time I've given to be with people is really stressful for me. And with my Black patients especially, I worry if they leave me, when they leave me, if I don't have enough time to sit with them, who else will listen to them? Who else will they feel comfortable opening up to? For many patients of color, I'm the only Black physician they've ever seen. That was very prevalent for me, especially in my last job in California. And then I have compassion fatigue. I'm an empath. I absorb people's emotions and anxieties. And so seeing that, carrying the weight of that day in, day out, day after day has definitely taken a toll. And because of all of this, for me, self-care is an imperative. You know, I can't afford not to take care of myself, to continue to be present for my friends, my family, my fiance, and my patients. I need to take care of myself.